Good evening, Los Angeles. Sorry for the short delay, but this has been a busy day. Let me start by thanking you all over this weekend for the great work that you did to keep Los Angeles safe as we take steps forward, and to remember yesterday those fallen heroes in this country that gave their lives for our nation. I know that for all of us, it wasn't the Memorial Day we always remembered, but we certainly, I hope, paused for both the pain and the pride that Gold Star families felt throughout this city and across this country for the sacrifices that their loved ones have made now and in generations past. Somebody said, we never say as veterans or those who know people who have died, Happy Memorial Day. We just say it's Memorial Day. And indeed it was. I was at Cinco Puntos, which is in Boyle Heights, where a tribute to Mexican Americans who have fought and died in our wars wasn't exactly the same commemoration as we've always had, but bravely Marines and airmen and women, sailors and soldiers gathered to mark this day. Today is an important day in the many, many times that I've come before you and talked to you. I want to step back for a moment and talk about where we are. First of all, you have done your job. Can we find cases where people aren't? Of course. But 99% of the time, we've seen folks who have stepped up to save lives, to flatten a curve, to ensure that people's suffering is lessened, and to make Los Angeles an example for a dense urban area that has taken swift action to protect thousands of people who would not be here today were it not for you. We haven't just flattened a curve, though. As I've said each night, we've learned a lot about this disease. And I've also said we're not moving beyond COVID-19, but we're learning to live with it, how to be better in terms of slowing the spread by wearing our masks, physically distancing, washing our hands, and more. And as always, every decision I've made and my fellow leaders have made here in Los Angeles have been guided by principles. First, that every life is sacred, that it's important that we not just dismiss who, no matter what their age or pre-existing condition, is affected by COVID-19, but that all of us act together to save lives. It's been an extraordinary thing not to just see here in this city, but around this country and around this world, that literally we have stopped at the price of great economic suffering in order to save our fellow human beings, many of whom are much older than us, many of whom were much more vulnerable than us. It shows not just LA love, but the power of human love. But second, our principle is that we have to consider always three elements of health and balance them. Our physical health, our mental health, which we've always tried to address in these tough, tough times, and our economic health. Knowing, as I've said, that we would not be in black and white, we've never been fully closed, and we know that there will still be things we have to do until we know we are fully out of the woods with COVID-19. So that gray area in between, where we do things but we learn how to do them safer and safer and safer, that has to guide us. The third principle is that we will always be guided by data and by numbers, not by politics, but by the sound advice, and not just by public health professionals, but by those workers and those industries that are suffering, to make sure those numbers inform us, whether it's an unemployment rate, whether it's legislation that leaves immigrants behind, whether it's communities of color that have disproportionate impact and deaths, or whether it's our seniors, as well as the data that's coming forward on the deaths, the hospital admissions, and everything else. So as we look at these, it is very clear that we have earned this day, and that Los Angeles, it is time to move forward, to reopen, to look at more that we can do safely, 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 to make sure that the suffering that so many people are feeling right now economically doesn't come at the price of also suffering in human lives, that we protect both moving forward. I just got off the phone with the governor. I've spoken as well with our county supervisors. And tonight, I want to announce important changes that are coming to Los Angeles. Yesterday, the governor issued new guidance about what's next for retail, houses of worship, and their reopening in the state. And remember, when the state sets new guidelines, counties have to decide whether they can meet those guidelines to get the permission. And cities within counties, like LA City or Pasadena or Long Beach, which have their own health authorities, and the other 85 cities of LA County, also have to align with those state mandates as well. We have to decide whether local public health, measured again through data, meets the thresholds that make us not confident, but confident enough to move forward, to permit the opening of additional businesses and activities the state allows. And I want to reassure everybody watching tonight, we have experience with this, a proven track record in this crisis. Whether it was farmers markets that we shut down and reopened with good guidance, the construction trades that we kept building critical infrastructure and bringing paychecks home to tens of thousands of local workers, we learned how to do this and how to do it safely. And of course, we've been doing it in places like our grocery stores and pharmacies since the beginning of this crisis. Right now, up to this day, our retail businesses like clothing stores have only been open for curbside pickup and delivery, while other grocery and drug stores, hardware stores, and warehouse stores allow customers to shop inside. Simply put, that status quo has put our small retail businesses at a disadvantage, pushing customers to shop online or at large warehouse chains. Now it's time to even that playing field and to do it safely, to allow all retail businesses to let customers inside the shop so that we can protect lives and safeguard livelihoods. Every store will have to adopt county safety protocols that ensure that they are safe for workers and customers alike. And the sooner that stores can safely welcome customers inside to shop, the more we'll see our stratospheric unemployment that some estimate is higher than during the Great Depression here in Los Angeles, that we can finally see that begin to come down. If we don't do it right, we'll see things get shut down. But I believe that we can do it right, and we've earned the right way to do it. That means that more Angelenos will be able to earn a paycheck, pay for their rent, put food on their table. It means that small and medium-sized businesses that are the bedrock of community wealth and our main streets will be able to have the same competitive advantage that we've given to others, that they can stop counting the days to bankruptcy and instead begin to restore their balance sheets and get back to providing the services that we all count on. And that's why tonight I can announce that starting tomorrow, all retail establishments may reopen for in-person shopping. With the proper safety measures and with extraordinary caution, we can now go back into all stores. As I said, the reality is since the beginning of this crisis, people could get clothes, beauty supplies, sporting goods, shoes, furniture during this emergency as long as it was in stores that were either pharmacies and or grocery stores. That meant that we could shop at Target or Costco, and we appreciate the workers there, and those companies stayed open. But we couldn't shop at our local neighborhood stores. They have suffered, and many are on the point of not coming back. We know how to shop safer. We have learned a lot about social distancing, wearing our masks, making sure that we follow the protocols for washing our hands. But it's time to make sure we don't punish our local stores and that we begin to fortify again our main streets. Let me be clear, the next step does not yet include personal services such as hair salons, nail salons, and barber shops, and I know how badly many folks need to get back into those spaces. And we're not reopening restaurants for dine-in service at this time. And I also want to make clear that while retail businesses can open, they are not mandated to open. Take your time. Get it right. Go to our coronavirus.lacity.org/business website, and if you're a business that is a retail business, download this helpful packet that gives you all the guidance, the things that you'll need, the checkoffs that you need to make sure are done, how you get through the county official process and post that to let customers and our county government know that you're abiding by the orders for safely reopening. So every business that is reopening should download, complete, and post the city's business toolkit, which includes that county's physical distancing checklist and the protocols. Don't wait to take this step. Do it now. It doesn't mean you have to open tomorrow. Many stores won't be able to. But as soon as they are, we want you to do it safely, and we want to be there to shop at the stores that we love, see those owners and employees that we've known, and make sure we can begin to see those rays of light for LA's local economy come back. Houses of worship are also permitted under the new rules to reopen, but they must not exceed 25% capacity or 100 people, whichever is smaller. Many of us want nothing more than to join with our communities, to reflect, and to pray, to gain a sense of hope from our faith traditions. But I want to give a big note of caution here. We saw many tough stories early on before we knew about COVID-19, how choir practice or a funeral or a church service led to spread. So again, just because it's permitted doesn't mean you have to do it. And secondly, let's be sure in our synagogues and our churches and our mosques and our temples, we open slowly and carefully. Because no matter what you believe, we are all focused on that unites us and the divine in every human being and why it is important to protect that. Here too, remember this is guidance. Reopen when you are ready. These are very important steps forward as we learn to live in this new COVID-19 reality. For our economic health to have more stores open, for our mental and spiritual health to be able to pray with others and to have the guidance of our religious leaders, and for our physical health to always do this in the safest of ways. Los Angeles may not always be first, but we will always be guided by our data and the smartest, safest ways to move forward. More jobs when a business is open, spread throughout Los Angeles. Less government assistance is needed to prop these up for one more week. And I'm committed to getting these businesses up and running safely. And just because you can open doesn't mean you have to open. So take time and remember to always save lives. This gray space is a tough one to live in. I know it is tough for us to contain. It's confusing. What's the federal government saying? What's another state doing? I live 2 blocks from another county, and it seems to be so different. This will help us align in this region, what we can do. But we can also continue to be the leader Los Angeles has been, taking the right steps and taking the safe steps as we move forward. I want to also say that we have based this all on the data. So let me run through some slides now that show why I believe we can confidently take these steps forward. A few weeks ago, I said we had to not just do this based on emotion, but we had to do this based on the facts. So, together with the county and with state guidance, we've been looking at those metrics that are the minimum that we need before we can even contemplate taking the next steps. I'm proud to announce that we've met those. That's why our county supervisors voted to move forward. That's why we, as the city of Los Angeles, are also going to be updating our order to do the same. First is hospitalizations. We look at hospitalizations because it is one of the early tripwires to see what's coming down in the weeks ahead of potential fatalities and of what the ICUs and ventilators and PPE strains will be on our system. And the state mandated you cannot move forward until you have stable hospitalizations on a 7-day average of changing of less than 5%. Today, we have met that. Second, you have to look at the cases per population. In other words, when you do testing, what percentage of those tests are positive? Remember early on when we had tests that were 20% or higher positive? Well, today, through the city and county drive-through facilities, we are under 5%. And the state says as long as you're under 8%, you're good to go. We achieved that together through a lot of hard work. And thank you, just as a side note, you probably saw my LA Dodgers mask I got today when I was at Dodger Stadium. Let me say how amazing it was to be at Chavez Ravine to open up what we think is the largest testing center in America, able to do 6,000 tests a day. It was extraordinary to see, and I thank CORE and our fire department for helping us. Third, we have to look at our testing capacity. How many tests can we do? The standard is you need 1.5 tests every day for every 1,000 residents. Translated into LA County, where we have 10 million people, that would mean 15,000 tests a day. Right now, we have the capacity to do 20,000 tests a day, but we are meeting that 15,000 a day minimum, a third metric we have reached. Fourth is contact tracing. This is our ability to make sure when we find a positive case that we can talk to her or talk to him, ask them, who have you been in contact with, and within 24 hours, make phone calls, sometimes lasting as long as 40 minutes to each one of those people to make sure that they quarantine themselves. Thank you to our County Department of Public Health, Dr. Ferrer and her staff. They're able to turn that around within 24 hours. That is the standard. And also the state says to make sure we have sufficient staffing. We now have that, and we've offered many more should we ever have to surge up, of both county workers that are learning to be contact tracers and city workers from the city of LA that are available to help should we see the need arise. The fourth thing where we've hit the mark. Fifth is our ability to surge our hospitals. I know it gets boring when I share with you what our hospital numbers are, but they're so critical because if we don't have the capacity to have enough ventilators and enough beds, enough ICU beds available in particular, we can't meet any surge that happens. And we have the state requirement is that county or regional hospital capacity needs to be able to accommodate a minimum surge of 35%. Thanks to the work that we've done throughout the county, and thanks to the work that the hospitals have done, again, we've met that mark. And then the next one is about our preparedness, that every county that moves forward must have our skilled nursing facilities have a plan for outbreak prevention and containment. The county's been working extremely hard, and we listen to them and where we need to go. But I'm proud that in the city of Los Angeles, of 135 skilled nursing facilities where seniors live, we have now gotten all 135 into a program where we're providing tests or they have tests on their own. In 107 of them, we have provided that to them through our contact with Everlywell and UPS and our LAFD surge and strike teams that have gone in, either because there's a case or before there's a case. We are the first city in America to mandate monthly testing in these places. So again, we've met that. And this is a place where I know we can reduce the deaths that we've had. There's one last category that has many things in it, whether it's the number of people, 15% of your unsheltered population has to be in shelter. We do have that. It's other things that look at PPE. But the bottom line is we have earned these steps. We would never, I said, take steps forward one day earlier than we should, but also not one day later than we should. I know this feels unsettling to some who want to close down as long as we can until there's a vaccine or something else. And for others, it may feel like, why aren't we going even quicker? We have to balance these two things and do it safely. But we have to not be afraid of taking steps forward while also mandating that our personal behavior will prove the success of these steps or not. So let's turn to today's data to see where we're at with cases today. Today, the county reported 1,843 new cases. This brings our total number to 47,822, a 4% increase since yesterday. Still a low percentage increase, but one of the highest numbers, if not the highest number we've seen. That's because of the compression over the weekends and the long weekend of the number of cases that come forward and our increased testing. For comparison, we've had about an average of 1,200 new cases each day over the last 7 days. And as I said, this higher number is probably because of the backlog over a long weekend. The more testing we do, the more cases we report. In the city, this was 748 new cases, bringing a total of 22,567, a 3% increase. And today we learned of 27 deaths countywide, bringing our total to 2,143. This is a 1% increase since yesterday, and we're averaging about 33 new deaths a day. It's important to pause here because this has been stable. I never say that's good news because these are human beings, and these are deaths, and they're connected to families and communities. And we mourn with everybody who has lost someone here in Los Angeles and anywhere in the world due to COVID-19. In the city of LA, we now have 1,051 deaths in the city of Los Angeles. Across the county, we still have good news, as I mentioned, with our threshold in our county, in our general emergency hospitals, where 1,132 beds are available, 932 of them in acute care, and 200 ICU beds, as well as an inventory of more than 1,200 available ventilators, 1,206. A vital tool in maintaining hospital capacity is that testing. And that's why I was so proud today to be out there at Dodger Stadium. There's now 36 testing locations, and we have the capacity to test 25,000 people each day. I shared that the first day, just a couple months ago, we opened up the first testing facility. It was 145 tests that day, and we were proud of that. Now it's more than 100 times that each day. And by the end of today, we will have tested over 500,000 people between our testing centers and our hospitals and labs. I want to also thank at Dodger Stadium not just CORE and the Dodgers, but also Live Nation and Red Rock Entertainment, who have provided great screens. There's a so you can find out how to do the test before you get through the line. They've also put radio on that you can tune in and hear it all. All of this is going to be for faster throughput. It takes a day or two to get it humming, but we had thousands of people there today who successfully got tested. And if you haven't got tested or you need another test, please sign up at coronavirus.lacity.org/testing. It's free. That'll help you go anywhere in the county as well. Or you can always call us, 213-978-1028, or call 311 after 5. Look, as I conclude, I know this isn't easy. I know living in the in-between is not where anybody wants to be, but it's better than living completely in the shadows or running too fast simply to the light. Everyone wants to move forward. Everybody wishes we could just get back to normal, gather with family and friends, shop without face masks on, celebrate, share a meal, enjoy the beginning of our beautiful LA summer. But we have to stay vigilant and we have to stay resilient. We have to take this one step at a time, but this is a good day for Los Angeles, one that you have earned by the work you have done. And I want to thank all my fellow local leaders and government workers who are out there on the front lines, our hospital workers. And remember, let's not get tired of wearing a mask to protect somebody who's at a grocery store, of keeping our physical distancing to keep a neighbor from getting sick, of washing our hands religiously so that we can make sure that this virus does not begin to find a new fertile home and see cases expand. The future depends on us. The fate of this city is in your hands, collectively, all of ours. And I'm so proud of Los Angeles for rising to this challenge, of meeting this moment. So don't let up, don't get careless, keep doing what you're doing. Stay safe, stay healthy, and stay home whenever you can. Lots of strength and lots of love to you, Los Angeles. We'll see you out there in LA. With that, I'm happy to take questions. First question, please.
The first question will be from Robert Kovacic with NBC. Please go ahead.
Hi, Robert.
How are you, sir?
Good. How you doing?
Fine, thank you. Quick question. There's rumblings that have been going on for several days now about the potential opening of Runyon Canyon. Can you give us an update on where we are with that?
Yes, I'm so glad you asked that question because I think I forgot that point in my talking points. Runyon Canyon opened today, and it is open. We have put in place counters to make sure that we don't have too many people, that we're not over capacity there. We'll have our rangers and rec and parks folks out there. But Runyon Canyon, working together with Councilmember David Rue, is now open again. So be safe. Make sure you're out there. Wear a mask. A lot of people still aren't wearing masks, and especially in a place like Runyon, which can get crowded, make sure that you have that on because you're going to come into close contact with people. And it is a one-way loop. So instead of people crossing both directions, it's now a one-way loop. Enjoy it. It's back. It's one of the greatest places in LA. Thanks, Robert.
And all of the gates are open?
I believe so. There might be slightly different, but I think for entry, yes, you can get into different gates, but you have to keep with that. I believe it's clockwise loop.
Thank you, sir.
Thank you, Robert. Enjoy. Maybe I'll see you out there.
You got it.
Next question, please.
Next, we'll go to the line of Claudia Pashuta with KNX News Radio. Please
Hey,
go
Claudia.
Hi there. I have a couple of questions.
Sure.
Would like to get an update on Project Room Key, and do you think the county is ever going to hit this 15,000 goal? If so, by when? And I'm wondering how you're going to get city employees to accept furloughs when police officers are getting bonuses and raises. Thank you.
So Project Room Key is right now, we have 3,372 rooms. I don't know, quite frankly, whether we'll get to 15,000. I know 15,000 statewide has certainly been one of the goals, but 15,000 people is the goal, not necessarily rooms. So as people come through and we're able to house them, we're going to count the number of people. That's always been the goal. But I certainly hope we'll continue to reach for that. The city has put forward plans, including money that we're going to take from our coronavirus relief funds, together with our city council, to make sure we house more people. And we've got the state to match those dollars. And I know the county wants to bring their resources. And I've talked with a number of supervisors for permanent locations that we can either build or buy that will take people from those hotel rooms to permanent places. In terms of our core of work, whether that's our sanitation workers that have to continue picking up the trash, or people who answer 911 calls from the police department or the fire department. We will continue to make sure that those folks are there. Those are critical services, and it's not just police officers or firefighters. It's also sanitation workers and other critical employees who won't be furloughed. We would furlough everybody if they weren't critical. That's just a reality of this budget and this time. It's no different than what happened in 2008 as well. And by the way, raises that are given to police officers and firefighters are also, there's raises that non-police officers and firefighters will get. Obviously with furloughs, there's a cut. I'm furloughed, I get that same cut as well because I'm not a police officer or a firefighter. And I'm hopeful that if Washington can pass the HEROES Act, and the House has already done it, that we can see in the future those furloughs reduced and possibly even eliminated, but we have to balance the budget. Thank you. Next question.
Next, we'll go to the line of Elizabeth Chu with LA Daily News. Please go ahead.
Hi, Liz. How are you?
Hey, Mayor. I just want to double check something. I thought it was my understanding that the county needed to sign off on the retail in-store reopening. I don't believe that's happened yet, but you might know better than I do. How are you able to make these changes, including the one to the House of Worship, when the county hasn't announced anything yet?
They have. You might not have seen the press release because it came out in just the last hour, but they were in closed session today. They moved that forward. It just came out. So that has been both county, and we will align our city with that as well. It's correct that the county has to make that determination for any city to be able to do that. Now that they have, we will as well. Something that I think we have earned, and something that we probably had earned a few days ago. So I'm glad to see it there. There's a lot of people suffering, and we can do this safely, we can do it strongly, but that came out in the last hour. Thanks, Liz. Next question, please.
Next, we go to the line of Steve Gregory with KFI News.
Hey, Steve.
Oh.
Go ahead.
Hi, Mayor. Good evening. Yeah, hi, Mayor. I just real quickly, yesterday I was asking you a question, but you were decked out in your Naval Reserve uniform
Yes.
and couldn't answer.
Correct.
So I'm wondering if you might be able to answer a question today. I was asking about your response to the federal government wanting to come in and take a look at how the city of Los Angeles and the county have been taking care of the COVID response. They claim that heavy-handed tactics, I think, was the word that was used, and they seem to be a little baffled as to why there are so many cases and so many deaths. I wonder if you have a response to that. And secondly, I'm wondering if the nursing home stuff is going to ramp up your task force. Where are you at with the task force right now? And how are you doing with testing and things of that nature? Thank you.
Of course. Let me start with that. We're at 100% now. 100% of those nursing homes we have either under our, most of them under our testing regimen where we supply the kits. We train them up and they can do them. And if necessary, we can bring firefighters to even assist with that. The other, that's 107, I believe, of 135. The remainders either are doing this with their own money and privately, or in some cases, I think a couple of them also directly with the county. So it's really, to me, been inspiring. I want to thank Jeff Gorell, my deputy mayor. I want to thank Chief Terrazas and everybody. When we said this is a priority, and I believe we can cut our deaths maybe in half if we just have this regular, that is now in those nursing homes, and I hope that that will continue to help us push deaths down. In terms of federal government, I don't know. As I said, we've never played politics. We just look at the numbers. We look at the data. I shared that data with you today. There are so many places in America that have worse data, but we also have vulnerability here in Los Angeles. It's important to remember that we have a lot of pre-existing populations where the health indicators will potentially have more mortality, but we got kind of mixed signals. One said we were going too fast, one said we were going too slow from Washington. I kind of don't ignore them. I always listen to advice, but we don't kind of play politics with this. We will always look at the data. We're very confident that we've met what the state has put out, that's nation leading, and we're a big county, so we're always going to have numbers. The cases really are as much a reflection of our expanded testing as it is the number of the rate. So I look at that testing rate, and when we were up at 20%, and now through our testing centers, we're under 5%, those numbers don't lie. That's good news. Thanks, Steve. Next question.
Next, we will go to the line of Mary Beth McDade with KTLA Channel 5 News.
Hey, Mary Beth.
Hi there. Nice chatting with you. I just want to get a little bit of clarification of the announcement that you made, because it's hard to tell sometimes if you're talking about just LA City or you're also talking about county-wide.
Yes.
So it sounds like you spoke with the supervisors and the governor and that the LA County variance has been approved, in which case this will allow you to open up in-store shopping retailers. And are you saying that tomorrow that these retailers are only going to be open in LA City or all retailers county-wide? And then also I'm wondering, why are we not then also moving forward with reopening in-dining restaurants?
Sure.
And also the reopening of, your churches. What's the other thing that everyone else can do? Hair salons. Why can't we do that?
Exactly.
And is the county going to allow for that? I mean, can other cities within the county reopen their hair salons and in-dining restaurants?
So let me be clear, because those are great questions, and I know how confusing this can get. I'm not a representative of Los Angeles County. We have 5 superb supervisors who represent us. They met, and they have said for all of Los Angeles County that first step, which is permitted without a variance right now throughout the state, as long as county officials give a green light, of retail inside and the religious institutions, 25% or no more than 100 people, that does, can, and will move forward right now. So starting tomorrow, you'll see those stores open, and churches, synagogues, mosques can do that, not just in the city of LA, but across LA County. Now, cities can decide not to do that, but we are aligning LA City with that, so that will be across the county. I can't speak for 87 other cities. Some may decide not to, but I don't expect any, and I'm regularly in contact. So the county put that out. I know the timing is tough because I just gave my presentation, and it was probably 20 or 30 minutes before I came here that the county put that out. Second is there are then the so-called phase 3, step 3 stuff that is permitted if you get a variance. The county also took action to apply for that in the state. I believe they're guesstimating that could take 2 or 3 days at a minimum, so maybe by the end of the week. But that's where the beauty salons and barber shops are. That's the restaurants, in-restaurant dining that we've seen in other counties. So that is not anywhere in LA County. That's not permitted until the state gives you a green light. But the retail, religious institutions, which is now permitted in the state as long as the county that you're in gives a green light, that now is in effect. The county took that action. LA City aligns itself with that. So we certainly will, not just in LA City, but if you're in one of the other 87 cities, unless they decide not to, that is also in effect there starting tomorrow. Is that clear? Do you have I'm happy to follow up. Is
that clear? Yes, no, I got that now. So what you're saying is you don't need a county variance.
Correct.
To reopen, let me turn that down. To reopen in-store shopping or churches. But
Correct.
You do need a county variance to do in-dining restaurants.
Yes.
And hair salons.
Yeah, it's a state variance given to counties, correct. And that is something that the County of Los Angeles, based again on metrics, I want people to be clear, has applied for. We have to wait for the state. Who knows what the turnaround time will be, but I would think confidently the state will look at that and say it can be done. Then we'll have to see when it's done and how it's done, always with a premium on safely doing these things. Thanks, Mary Beth. Next question.
So our next question will be in Spanish, and we'll go to the line of Victor Cordero with Estrella TV. Please go ahead.
Hey, Victor, buenas tardes.
Alcalde, buenas tardes. Thank you very much. I'm going to ask my question in English, and then I will ask it in Spanish, and hopefully you can respond in both.
Great.
And I'm going to divide it really quick, just like my friend, my colleague, Mary Jade from KTLA did. A couple of questions really quick. Number one, what is the word that you can provide to all these small restaurants, small business owners that cannot open just yet their dining, and they feel frustrated because another county is just as close as Ventura County or Orange County, and I'm talking about cities like Simi Valley, which is right here. Restaurants are opening. What can you tell them to ease their frustrations, because they're barely making the money to pay their rent and everything, and they're facing a lot of trouble, number one. Number two, Are we waiting for the government of California to tell us that there's zero infections or zero deaths in order to proceed? And my last question is for my friend Viviana. She's working the story. What can you tell us about the hair salons and nail salons and all those people that also need to go back to work? Thank you.
Thank you. Absolutely. So to be clear, the county has taken action to ask for the variance, as we've seen in neighboring counties, to allow for restaurants to open at very limited capacity, but indoors, barber shops, hair salons, nail salons. So the next part, phase 3. That application is being submitted, I assume, either tonight or tomorrow morning. And estimates are it usually takes a day or two. Maybe it could be done quite quickly, and we'll see it sooner. But this week sometime we should get an answer back, hopefully a positive one from the state, and those folks will move forward. Second, I'd say to those owners, I get it. I get it for you. I get it in terms of your employees. This has caused great suffering. And I know there's some people who say, well, please don't open. But I think we've learned the lessons of how to do it safely and how to assess whether we're successful. So to watch this for a couple weeks, if necessary, hit a red light or even step back, but hopefully to at least have a yellow light and to kind of slow down, or green light, and continue to proceed. These are already in motion, and that's what makes today exciting. So to see as big a step today that allows us to have retail open inside tomorrow, I mean, how long have we been waiting for that? And let's enjoy that moment for a second. And then secondly, to be able to know that now we're finally on deck, ready to move forward with those others. If the state agrees with what we've seen, the county numbers, the metrics show us, I think that relief will be coming very soon too. It's just a different process. So, en español yo quiero decir unas palabras también de esta pregunta. And sorry, you also asked about zero deaths. No, that was taken off of the requirements. As we said to the state, counties as big as Los Angeles County with 10 million versus a county in Northern California with 9,000. To have zero deaths, we wish for that every single day. I pray for that. But it's probably unlikely to have zero deaths. So give us a more achievable metric that's proportionate to our population. They changed that last week, so that's no longer on the table. En español, el condado de Los Ángeles ha aplicado por una varianza, I hope that's the right word, una varianza, por barberos, otros lugares y también por los restaurantes. Y espero que esta semana nosotros podemos tener una reapertura de estas cosas con límites. Pero hoy tenemos progreso, y yo tengo más palabras de esto en mis palabras en un minuto, pero hay pasos muy fuertes, pasos muy exitosos y pasos muy importantes para restablecer nuestra economía local, atraer nuestras tiendas a nivel del vecindario, a una igualdad de las tiendas grandes como Costco, como Target, como Walmart. Este es importante por los trabajos, este es importante por nuestros vecindarios, este es importante por nuestros negociantes pequeños, y es importante tener progreso con seguridad. Y no es una regla ahora a tener cero fallecieron en su condado como una condición de la reapertura. Fue un cambio en la semana pasada, y por un condado con 10 millones de personas somos muy, muy diferentes de un condado con 9,000 personas en el norte de California. Y gracias al gobernador Newsom hemos hecho este cambio. So with that, I'm going to go to my address in Spanish. Again, I would just reiterate, please, if you're a business, go to coronavirus.lacity.org/businesses and check out the guidance that we put out there for our curbside and doorside pickup now as people are able to come indoors. To folks who are still not wearing masks, that is still the order, and not only can, but most businesses are refusing folks as customers who are not wearing their masks, so please do. It's an act of freedom, it's an act of love, it's an act of saying I care about my neighbors. and continue practicing safe social distance. I trust you. Use your judgment. People always say, are you going to crack down? This won't turn into some sort of a police state. It's the opposite. It's a trust state, a place where we have been successful in driving these numbers down, meeting these metrics because of our collective work. And from that, I thank you from the bottom of my heart. With that, I'm going to turn to Spanish, and thank you all. We'll see you soon. Muy buenas tardes. Momentito. Muy buenas tardes, Los Ángeles, y gracias por venir otra vez a la alcaldía por estas palabras muy importantes. Durante esta crisis, nosotros hemos sufrido. Es una crisis no solamente de nuestra salud física, pero de nuestra salud económica también. Y como su alcalde, les digo que sus acciones han logrado aplanar la curva con éxito. Hemos aprendido mucho sobre cómo vivir con COVID-19. Siempre nos guiamos con ciertos principios. Cada vida es sagrada. Y tenemos que seguir los datos y los números para guiarnos. Algunos al principio dijeron que no deberíamos de haber cerrado nada, pero la historia nos dirá cómo hemos salvado vidas. Algunas dirían que debemos mantenernos cerrados para siempre, pero esta sería irresponsable. Los Ángeles, ya es hora para abrir nuestros negocios de nuevo y hacerlo de manera segura. Acabo de hablar con el gobernador y los supervisores y esta noche estoy preparado para anunciar algunos cambios importantes. Ayer el gobernador emitió nuevas pautas para la reapertura de negocios minoristas y lugares de adoración. Cuando el Estado emite nuevas pautas, los condados y las ciudades deben determinar si las condiciones de salud pública local han mejorado, suficiente para permitir la reapertura de comercios como lo permite el Estado. Y por eso, esta noche estoy anunciando que empezando mañana, todos los negocios minoristas pueden abrir de nuevo para recibir clientes dentro de sus tiendas. Con las medidas de seguridad adecuadas y con mucho cuidado, podemos regresar a entrar a las tiendas. Esto no incluye servicios personales como salones de belleza, ni salón de uñas, ni barberos. Y todavía no estamos abriendo restaurantes para cenar adentro. Quisiera clasificar, negocios minoristas no están obligados de abrir. Y si necesitan más tiempo para preparar, tómanlo. Y los otros negocios, salones de belleza, salones de uñas, barberos, hay una aplicación del condado al Estado para permitir la reapertura de estos negocios en el futuro, en 3 o 4 días tal vez, pero necesitamos el permiso del Estado. Para cuando están listos, pueden encontrar las pautas en la página coronavirus.lacity.org/business. Y hay un guía por los negociantes, por sus tiendas, las cosas que son muy importantes para mantener la seguridad y la salud de sus clientes y sus empleados. Todos los negocios en el proceso de abrir de nuevo deben bajar y llenar y colgar la lista de protocolos para negocios. No esperen, hágalo hoy. Lugares de adoración están permitidos para abrir, pero no deben exceder el 25% de su capacidad o 100 personas si ustedes son una iglesia muy grande. El número más bajo de los dos, 25% o 100 personas. Hoy también estoy orgulloso de anunciar la apertura del Cañón Runyon. Debido a su popularidad, hemos agregado medidas para limitar el número de gente que visita a la vez y mantener a todos seguros. Reducimos el número de gente que puede entrar a la vez y tenemos contadores electrónicos para monitorear y tenemos senderos de una vía. Y deben llevar coberturas faciales cuando están cerca a otras y mantener los 6 pies de sana distancia en el parque. Estos son los pasos que tenemos que tomar mientras entramos en esta nueva realidad con el COVID-19. Pero tenemos que seguir con cuidado y hacer lo que es lo mejor para nuestra región. Siempre haremos lo mejor para Los Ángeles, según los datos. Aquí les comparto los datos de hoy. Hoy hubieron 1,843 nuevos casos en el condado de Los Ángeles, llegando al total de 47,822. Este número de nuevos casos es un récord, pero también es una reflexión de este fin de semana, los 3 días, y más y más pruebas, no del rato de la infección de COVID-19. En la ciudad tuvimos 748 nuevos casos, llegando a un total de 22,567. Y hoy supimos del fallecimiento de 27 personas más en el condado. Un número muy triste, llegando a un total de 2,143 muertes. Pero este número está reduciendo cada día. Y esta es una buena noticia, pero cada muerto es una tragedia por las familias, por nuestras comunidades y nuestra ciudad. En la ciudad de Los Ángeles ahora tenemos 1,051 muertes y oramos con todas las familias quienes han perdido un ser querido. En nuestros hospitales tenemos 1,132 camas disponibles. Entre ellas, 200 están en las unidades de cuidados intensivos y tenemos 1,206 respiradores disponibles también. La capacidad de hacer pruebas también es crítica en esta lucha. Por eso ampliamos el acceso a pruebas gratis en el condado. Ahora tenemos 36 sitios de pruebas disponibles en el condado y hoy tenemos la capacidad de hacerle pruebas a 25,000 personas cada día. Y al final de hoy habremos hecho pruebas en estos centros a aproximadamente 465,000 personas. Y esta mañana abrimos un sitio de pruebas en el estadio de los Dodgers, uno de mis lugares favoritos en la ciudad de Los Ángeles, donde tenemos la capacidad de hacerle pruebas a 6,000 personas cada día. Es el sitio más grande para hacer pruebas en el país. Todos se pueden hacer una prueba gratis, aunque tengan síntomas o no. Para hacerle una prueba, visita la página coronavirus.lacity.org/testing o llámanos a 213-978-1028 o al 311 después de 5 de la tarde. Nuestro destino está en nuestras manos. Este es un gran día por Los Ángeles, pero solamente con las acciones seguras de todos de nosotros. Estoy orgulloso de esta ciudad por lo que han hecho para enfrentar este desafío. No paren. Sigan practicando las medidas para cuidarse. Quédense protegidos, quédense en buena salud y, por ahora, quédense en casa. Como siempre, fuerza y amor, Los Ángeles. Y hasta pronto. Gracias. Thanks so much.